Tonight on Bees In with Brit, we're diving into a topic that has quietly become one of the biggest animal welfare crises in America. From overcrowded shelters to heartbreaking stories of loss behind the scenes, millions of animals are being impacted by a shelter system that most of us don't fully understand, which is why I brought Anthony Robles here tonight. He's the co-founder of the Animal Welfare Defense Center, formerly known as the Animal Welfare Data Center, and he's going to share how data, transparency, and everyday people like you and I may hold the keys to changing this entire system. Plus, we're going to share ways that you can start getting involved right now. So let's go talk to Anthony and learn more about these actionable solutions. Anthony, thank you so much for joining us today. I am really excited to get the opportunity to ask you some of these questions.
Yeah, of course. Thank you for having me. I'm really excited to be here and to continue talking about such an important topic.
I would love for you to introduce yourself to our audience as far as how you and your wife, Lauren, got started with all of this, because it is like a personal mission for you guys, it sounds like.
Both of us had animals that we grew up loving, and they're both rescue animals, extremely close to our heart. Hers was her best friend, and mine was my best friend. And both of us, we had a very hard time dealing with their loss. And so immediately after that, we wanted to pour ourselves into helping animals and volunteering our time with animals, which is how we got started down this path to begin with. And we had helped a local rescue pull a transport of puppies from a shelter in California called Apple Valley Animal Shelter. It was a great opportunity at our first introduction because it seemed like, wow, we're going to help a whole bunch of puppies. They have brand new homes waiting for them. We watched the staff handle different litters and dogs from completely separate kennels without using gloves. From my professional background in healthcare and in regulated environments, we're kind of standing up as, I don't know if this is the way that it should go, but I'm just paying attention now and trying to stay aware in case there's information I need to pass along to the rescues or the new fosters. And through this whole process of just trying to pay attention to make sure we did everything, correctly, I couldn't help but notice a lot of things. And, staff that's not always properly trained or don't have all the right resources, to support some of these really complicated workflows where you have a lot of people coming in and maybe we know the animals are sick, maybe we don't. What ended up happening that day is that all of the animals from the different litters of puppies, I think total was about 19 animals between two mothers and both of their litters, and every single puppy in both litters ended up contracting parvo. Many of them ended up losing their lives. In fact, one entire litter passed away, despite all of the efforts to try to help them. And it was not just devastating, but it was traumatizing for the foster that was involved, for the transporters that were trying to help. When I was reflecting, thinking about the whole process, is there something I could have done differently? Is there something I could have done better? My background is in healthcare and in regulated environments. I couldn't help but remember all of these tiny little things that started to point out, I think there's a bigger issue here with policies and data and how these processes actually occur behind the door.
Will you explain to people who are wanting to understand more about what exactly this whole crisis is about? Like, what's going on?
Yes, absolutely. When we look at this whole issue, the whole crisis, it can be broken up into a couple of different compartments. And the way that we look at it is first talking about, if we were to envision these three categories to break up the whole big picture. The first would be intake and overcrowding. So right now we're seeing shelters that are running well over 150% capacity for most of the year. And what that means is that if the shelter is built for easy numbers, 300 animals, they're currently taking in 600 animals, or they're taking in 550 animals, and they're maintaining that for months at a time throughout the year. So right off the bat, just why are the systems being so overwhelmed by more intake and capacity starts to present questions like, why are so many animals coming in? Is it issues with stray? Is it issues with housing policies that are too strict in certain areas? Are there issues with abandonment? There's different things that could be happening. Another category of the issue is what happens after they're inside the shelter, which is the quality of care. So here's where you hear a lot of people talking about, why are so many animals euthanized? Why are so many of them sick? We see a lot of individuals talk about behavioral issues in animals and health issues in animals that are inside the shelter. And it's all, it's really sad, but it's also really devastating for the animals. They have to go through it while they're living their day to day. And so this standard of care that's carried out throughout the shelter is the second big piece. And the third pillar, which kind of connects everything all together, is what it represents or what it means for the local community government, the local leaders. So what we're seeing at the shelters, outside, are all just symptoms of how these communities run, how they deal with problems, how they intake issues and concerns that come from the community. So when we hear this shelter crisis, it's really hard to call it a shelter crisis, because in reality, we're talking about in each individual community, there could be different types of issues, from abandonment to violent crimes to lack of resources, lack of public programs. Any one of these things could be affecting every community in a different kind of way, but it all affects their intake and how much time they spend overcrowded. How the shelter actually runs inside determines their standard of care, and how they improve those problems directly depend on how involved the local government is, how involved the local government is with engaging with their own communities, with their own constituents. And so in a broad kind of sense, in a big picture, that's kind of a summary of the issue that we're dealing with, which, as you mentioned, I'm in California, you're in Texas, but we're talking about the same issues as if it's happening in the same city. And so clearly there are patterns that are occurring not just here, but in all the states across the US, that at some point, especially as data professionals, we have to look at and say, there are characteristics here, there are patterns here, there are trends that can be evaluated, and we can start developing strategic roadmaps around them.
It sounds like you guys are you're using these tools to find methods that are more effective than what we have currently, right? Because I feel like a lot of people look at this situation, and I mean, I've heard people say, well, it's just overwhelming. We're never going to be able to solve it. And yes, it may be a huge issue, but it sounds like, from what I've read, your website has so many amazing resources. And from what I've been able to gather about your mission, it seems like you guys are really trying to take things to another level and find some solutions, like based on this data. Will you explain a little bit about the data that you guys are finding, anything that you are finding encouraging, or, what you would do with what you've been finding, if you could change some things?
Yeah, absolutely. I think, where it all starts is when we talk about data science and business intelligence. There's a term that we follow that goes, you cannot improve what you cannot measure. And basically, in every organization, let's say we weren't talking about animals in public facilities, if an organization wasn't doing well, they would need to try and evaluate what's happening before they could start implementing these different processes. Being able to diagnose what is going on within our own systems is a hard enough problem as it is. But the truth is in 2026, there's so much technology available. There's so many professionals out there that want to get involved, that want to do this kind of work with these local agencies to try to help the animals and make an impact. And so it's, unfortunately, there's not one answer for every state, not even for every city. Even in my state alone, when we look at, just talking about some of the data that we're finding, if I look at, let's say, Orange County versus Los Angeles, the city of Los Angeles, what we see in the data is that Orange County, even though they have a huge intake as well, they have upwards of 50,000 animals a year, 49,000 animals a year. LA City is also seeing a similar number. But when you look at the intake, a huge portion of the intake, roughly 24% in Orange County, is coming from strays, and nearly 4% come from owner surrenders. People are not taking their animals into the shelter, but there's a huge boom of animals being found in the cities throughout that community. That's one issue. In LA, we see that the owner surrenders are very high, upwards of 20%, where the strays are also high, upwards of 40%. When we look at that, it now becomes an issue of, well, do we have housing issues? Is there a homelessness crisis in LA City that's leading to more owner surrenders? These are two different cities within the same state, not even 15 miles from each other, and they're completely different issues. And so our mission is, in reality, we see this whole thing as kind of like a three-layered process, in which the bottom layer is kind of the general public, the day-to-day families that are going in and adopting animals, that are taking care of them, and they're feeling the heartbreak when those animals pass or get sick. They're also carrying the financial burdens of trying to take care of them and to do the right thing by all of those animals. The second layer we like to think of is all of the kind of nonprofit organizations and the, volunteers that are dedicating all of their time to trying to figure out, okay, for that first layer of individuals that are trying every day to do the right thing, what can we bring to them as resources to help? What programs can we sign them up for? What kind of, forms can we give them to help them access resources? The third layer and that top layer, which is most important, becomes our community leadership. The legislators, the district representatives, your city councils and your mayors and your governors, all of these individuals are the ones that have the actual authority to be able to make the decisions that policies need to change. These new laws need to be integrated into our day-to-day communities. And so kind of looking at it in that way, our mission becomes part of the second layer. How do we successfully bridge that bottom layer to the top layer, the day-to-day people to those decision makers in the easiest, most effective way? Some of that is going to be on our data portal. We're talking about making new mobile apps that people can download and put in your zip code, and we will tell you who your district reps are and give you buttons to send off your emails. And so our whole goal is being able to create these modernized digital tools where we can turn every individual person into the modern day warrior for, advocacy, being able to take information and now become an informed advocate, going to these city council meetings and presenting hard data and facts to say, this is what we're asking for. That's our mission.
Oh my gosh, I love that so much. That's amazing. That is an amazing mission, and it's so needed. It seems like even if there is this information available, it's still so hard to break through to the leadership, even the leadership at the shelter. It almost feels like a closed loop.
Yeah, it can absolutely be difficult. I have a few different thoughts. One is, first of all, I want to reassure everybody, encourage everybody that's trying to get involved with this work, that if it doesn't come easy at first, that doesn't mean that you're doing it incorrectly. It doesn't mean that it shouldn't happen. Every single step that we take is important, and they're not always going to be as easy as the next. So it's important to remember the big picture, long term. What is it that we're striving for? The reason we're going and asking for all of that information is so we can try to influence the decision of someone down the line. And so when I think about my professional background, I'm not sure how many other listeners can relate to this, but I feel like this is a pretty common thing that a lot of us go through. I used to work as part of a team where I would have to take data and information to a decision maker, like my boss's boss's boss, right? Mm-hmm. And they needed to make a decision about this project that's pretty small, and it's, in the grand scheme of things, it's just for this one company, this one department. And this boss, by looking at all the data that I presented in those 10 minutes that we're sitting there, has to make a decision based on, this is the first time I'm looking at this, with some high level context, with 10 different people telling me 10 different things, and I need to decide right now what to do. And right. That in and of itself has already, I think that's the part that I'm saying, I think all of us know how frustrating that can be. Now imagine that on the big scale of a local government and community decision makers, where the layers of people that have to make decisions becomes thicker, the amount of time they get with those resources becomes shorter, and the amount of information they are receiving becomes more and more filtered based on what each individual person or agency's goals are. And that's not always, a bad thing or a negative thing or a malicious thing. Sometimes some individuals just aren't wired to think about, standards of care before they're thinking about their profits and their margins that they have to report to their bosses at the end of the day. And so when we're kind of faced with all of this and we're asking these questions about, can we have some transparency? Can we see this data? Can we see this information? Sometimes I think the reason we get so much pushback collectively as a community is because the individuals that are responsible for answering those questions and working through it, they themselves are trying to understand that information and that data. And the part that I think now that I'm observing is becoming a challenge, because I'm not saying that that's the right way that it should be done or that it's the wrong way. I'm observing that there's a very loud challenge between us being able to get information and us being able to present information that then those decision makers not only take with, yes, this is important, I should look at this, but also with a new lens. Because a lot of these decision makers, I feel like over the last few decades, have probably gotten accustomed to thinking about their strategies and pushing them the same way. Again, we're in 2026. It has not worked. It hasn't been working. We keep pushing, PR campaigns to say that it's getting better and this state is no kill and this state is getting to no kill. All of that really doesn't mean anything, especially when we look in the shelters and the quality of care is not improving. We're seeing more animals that get sick, more animals that are euthanized, behavioral issues are going up, and we're focusing all these strategies on this data, on this number, on saying we're no kill, instead of transitioning to a new lens, a new mindset of standards of quality of care, long-term sustainability, efficiency for communities. How do we give back to the community so we stop getting the constant weight of reacting to an issue? We have to get proactive to prevent these issues from occurring. And so this whole mindset needs to shift before we can start feeling a difference in that transparency, what we ask for.
Wow. I mean, you touched on so many things there that I think are just so important. You guys also talked about in your findings with the Dallas Municipal Shelter that there's this messaging about no-kill status and the 90% save rate. And Dallas is big on that. They do really emphasize that. And we did have a distemper outbreak in 2025 that I think brought a lot of focus onto, the shelter, the medical practices. It came out that they had suspended giving the double vaccinations at that time. And that is what, most experts believe led to the distemper outbreak reaching the scale that it did. They did go back to giving the full vaccination protocol. I mean, they stated that at the commission meeting. I don't know if that's anywhere in their programming, but there was a lot of emphasis on Best Friends Animal Society, who came in at that time, or at least they were more visible to the public at that time. And I feel like a lot was going on with them kind of taking over. Will you explain Best Friends Animal Society's role in a lot of municipal shelters and how they've, in a way, integrated themselves into the shelter system?
Yes, absolutely. There are a lot of organizations that are trying to focus in on solutions and data-driven solutions. And what we've seen on Best Friends' website when we first found out about them, we first started getting involved, is that they would post, all these data dashboards from across the country, all these different shelter systems and how they were doing. And that metric right there, the performance of how they were doing, right off the bat became kind of just questions on why are we deciding to make the comparison off of just a live release rate by itself with nothing else going around it. That shouldn't necessarily be a success metric as much as it's just an observational metric to try and diagnose what's happening. And
will you explain that a little further, your thinking on that? Just what do you think would be a better, additional metric?
Yeah, absolutely. I think what we need to look at is the Association of Veterinarian Guidelines is something that we started our work with because they were the first baseline that we found that kind of set up a standard. And what that is basically a committee of veterinary professionals got together and put together this really incredible guideline for shelters specifically to implement procedures and policies to maintain what they call capacity for care, to be able to hire staffing that increases with that capacity for care, how to update facilities to manage all of that. And so there are a lot of different things that go into a metric. And while I personally can't say I think this is the better one or that is the better one, I definitely think that what we should be focusing on, all the organizations, all the local agencies, not just one, because we all need to work on different things together, is I can't stress enough, it's the quality of care inside of the shelter. And a couple of factors will kind of indicate what the quality of care looks like. One of those things is length of stay. And it's the length of stay compared with the age of the animals, how they came in their health. So in other words, if we're seeing a large volume of healthy young animals coming in and they have lengths of stay like less than 5 days at a time before they're seeing outcomes like euthanasia, that is an indicator that that's not a good success metric. So while 90% save rate might exist because we're limiting the number of animals that the shelter will intake, they will literally close their doors and stop receiving animals, asking people to leave the animals where they found them, to keep them, figure something else out. That is kind of an unintended consequence of coming out and saying this 90% save rate is the overall success metric, because it's not. It's just containing that intake. And so after that, that length of stay is one metric to look at with the types of outcomes that go along with it. The second would be the illness rate. The shelters have a high volume of contagious illnesses like parvo, distemper, giardia, things that are preventable with processes. And that's happening, let's say, every single month. It's happening at least 3 weeks out of the month. that is a good sign that things are not looking good, even if the 90% metric is there. So again, with the behavioral issues as well, because all of the animals, when they go into the shelter, what we've seen in the data is they get flagged, for behavioral observation. They start putting in notes on how their progress goes the next few days. If we're seeing that increase in behavioral issues with an increase in length of stay, or a decrease in length of stay, meaning that animals are being observed to maybe feel really scared, have fearful reactivity, things of that nature that are normal because they're in a super stressful, compact environment, and it's just getting more intense and more intense by the day. Those animals are getting shorter and shorter time with less opportunities for training and enrichment, less exposure to the outside world and people that can help them work through those issues. All of these things are individual factors that we should be looking at as far as, success metrics. What is the quality of life inside the shelter for the animals? If that is under control, if we can maintain what the quality of life is like in there, then we can start focusing a lot of energy on the life-saving programs. Great. While they're here, we know they're going to be safe, they're going to be healthy, they're going to be okay. We're going to have constant exposure. While they're under control and stable here, let's focus on finding them rescues, on fosters, on reaching out of state, reaching out to other agencies and organizations. But right now, we're just focused on get that number down, get the save rate number up. And that's a bad way to look at any issue, because it's never going to be one specific metric that answers the whole problem. And what I also hope is, I want to make sure I'm clear about, is that our position in as far as the way we understand this process, it's not the shelter employees. It's not the individuals working at the front desk or managing the kennels or entering the data. It has nothing to do with these individuals. It's always the upstream management and leadership that are mandating the policies and processes and procedures in place. Those are the individuals that we're asking to get involved, that we're asking to sit with our organizations, to listen to new ideas and implement. We're asking the decision makers, behind the desks at the county level, at the city level, that manage the shelters. Those are the individuals who we are looking for their attention to, try to help us work together in solving this crisis.
Yes, that is such a good point.
And one thing that becomes challenging is being able to describe, is it or is it not successful, what's happening? Because that's what I think everyone always wants to jump to is, okay, but what has worked? But what has worked?
Right.
And I think what we're trying to emphasize to individuals, especially other professionals in the political arena, in the legislative arena, is it's not necessarily about what has already worked, because we're already fighting an uphill battle right now. We're trying to identify what will work. And that's going to take all of us pushing towards the same thing together in uniform messaging, standardized requests. What we're asking for has to be the same. And so, the way that we're using our data is in a couple of different ways. We engage this issue kind of in that 3-layer tier that I mentioned earlier. I think being able to define what it is that you want to solve for, that's going to take you a long way. It'll be the tether, the anchor that brings you back when everything else starts to feel kind of messy and convoluted and you're getting lost in it. You'll remember, what am I trying to solve? And that will keep you in the game.
Well, that is really wonderful advice. Thank you so much for your time, Anthony. I really feel like you have given us something good to leave with, because like you said, it can feel chaotic and sometimes you just don't even know what to do next. Will you tell everybody where they can find you, how they can engage with you guys on social media and on the website? There's just so much more that people can learn. You guys have great resources.
Yes, absolutely. So on social media, our Instagram is where we're the most active because we're constantly posting our research there. Thanks to my brilliant wife who puts together all of our research into really easy, injectable, slides and information that people can kind of get a sense of what's going on in our day-to-day research. You can follow us at Animal Welfare Data Center on Instagram, and it's going to be that same tag across the other social medias like TikTok as well and YouTube. And you can find us online at www.animalwelfaredatacenter.org. And to make it easy, if you'd like to explore our portal and all of the public data we do have available, at the end of our website, you can just do a /data portal, animalwelfaredatacenter.org /data portal. And you can access the data we currently have available. Thank you so much. I really appreciate the time, Brit, and thanks for giving us the opportunity to talk about all of our work.
Shortly after recording my interview with Anthony Robles, I learned of the euthanasia of a beloved dog named Jacob, a dog that my friend Sita and I had previously helped connect with a foster home when he was on the euthanasia list at Dallas Animal Services due to space constraints. Jacob spent more than 9 months with his foster, who was devastated and confused to learn of his fate. One of the volunteers who cared deeply for Jacob is Jennifer Grantham. Heartbroken by his outcome, she wrote a letter to Dallas Animal Services leadership seeking answers about the policies, procedures, and decision-making process that led to his euthanasia. In her words, there was no chance to save Jacob this time. No notifications. He was not posted on the MVP Facebook page. No calls went out to his previous foster. No review of Jacob's profile to see his wonderful notes, photos, and videos. No notifying of the volunteers who wrote and created them. He was put down as if he didn't mean anything, as if he didn't matter to anyone, as if he were a box to be checked. You can use the QR code on screen to read Jennifer's full letter with the details about how Jacob's situation unfolded. According to shelter records, Jacob was picked up by animal control and returned to Dallas Animal Services on April 26th, after his adopters of approximately 1 month reported that he had bitten them. According to the adopters, no skin was broken during this contact. The following day, April 27th, Jacob was euthanized for behavior and subsequently tested for rabies. Dallas Animal Services was aware that Jacob had previously been vaccinated against rabies, as the vaccination had been administered while he was in the shelter's care. A photograph taken at the time Jacob was picked up by animal control appears to show a dog with loose, relaxed body language rather than a dog exhibiting any obvious signs of distress. Following his euthanasia, the rabies test came back negative. This story is not about second-guessing public health protocols. Rabies is a serious disease, and animal welfare professionals have a responsibility to protect both people and animals in the community. But Jacob's case raises important questions. What specific observations led to Jacob being classified as a rabies suspect? What factors contributed to the decision to euthanize rather than pursue additional behavioral evaluation or observation? Was a review of Jacob's history, behavior notes, and prior placement experience conducted before that decision was made? Were former fosters, rescue partners, or other placement options considered? And when a vaccinated dog is euthanized under suspicion of rabies only to test negative afterward, what review process exists to evaluate whether policies were followed and whether lessons can be learned moving forward? Jacob's story also highlights broader challenges facing municipal shelter systems across the country, including the need for transparency and accountability in decisions involving animals' lives. For volunteers, taxpayers, and animal advocates alike, it is a reminder that when systems are strained, the consequences are often borne by the animals who depend on them. As of the recording of this program, Dallas Animal Services has not responded to Jennifer Grantham's letter requesting clarification regarding Jacob's case. Thank you so much for joining me for this episode of Be Zen with Brit. Be sure to check out the Brit Madrid YouTube channel where you can watch full episodes and bonus content. You could also listen to episodes over on Apple Podcasts or Spotify and keep up with us on Instagram at BZenTV. If you'd like to get involved helping animals in your local community, check out some of the resources on screen. Thanks again for watching. I will see you guys next month for an all new episode.